Cystodes or tapeworms include a multiple species of flatworms that can reside in the human gastrointestinal tract. So one of the example of cystodes is Hymenolepis diminuta. It is a cystode of rodents, infrequently seen in humans and frequently found in rodents. It is also known as the rat tapeworm, a species of Hymenolepis tapeworm that causes hymenolepiasis. It has a slightly bigger eggs and proglittids than H. nana and infects a mammal using insect as intermediate host, just like species from the genus Tribolium, for example, are the beetles. Its eggs are round or slightly oval, mo range iyang size from 70 to 85 mm by 60 to 80 mm with a striated outer membrane and a thin inner membrane. The space between the membranes is smooth or faintly granular. The oncosphere has 6 hooks. There are no polar filaments extending into the space between the oncosphere and the outer shell. This image is an egg of the H. diminuta in a wet mount stained with iodine. So four of the hooks are visible at this level of focus. 3 image of an egg of H. diminuta in an unstained wet mount of concentrated stool. So magdiffer lang din sila kung pilay magnification nga ilang giuse. This is the image of the proglittids of H. diminuta stained with carmine. So notice there is a formation of the craspidote. So this is the common intermediate host for Hymenolepis diminuta. It is a Tribolium confusum. So this Tribolium and related genera breed in cereals, grains, and grain-based snack foods and are easily ingested by humans and rodents, since these food products are usually not heated prior to consumption. Cysticeroids within the beetles remain viable and infective. Let's move on to its life cycle. So first stage is as eggs of Hymenolepis diminuta are passed out in the feces of the infected definitive host like rodents or humans. The mature eggs are being ingested by an intermediate host, mostly mga adults, arthropods like beetles or even larvae. And oncospheres are released from the eggs and penetrate the intestinal wall of the host during its third stage, in which it develops into cysticercoid larvae. Species from the genus Tribolium are common intermediate host for H. diminuta. The cysticercoid larvae persist through the arthropods morphogenesis to adulthood. H. diminuta infection is acquired by the mammalian host after ingestion of the intermediate host carrying the cysticercoid larvae on its fourth stage. So the humans can be accidentally infected through the ingestion of insects in pre-cooked cereals or other food items like grain-based snack foods and directly from the environment. So for example, oral exploration of the environment by children. So mostly gaka-infect ani is mga bata. So after ingestion, the tissue of the infected arthropods is digested, releasing cysticercoid larvae in the stomach and small intestine. So during fifth stage, the eversion of the scolysis occurs shortly after the cysticercoid larvae are being released. So using the 4 suckers on the scolex or iyang head, the parasite attaches to the small intestine wall. Maturation of the parasites occurs within 20 days and the adult worms can reach an average of 30 cm in length. So eggs are being released in the small intestine from gravid proglittive during its Ica7 stage, in which this integration after breaking off from the adult worms. So the eggs are being expelled to the environment in the mammalian host feces. The diagnosis of infection with Hymenolepiasis is made by direct examination of eggs in concentrated stool specimen, and Hymenolepis diminuta infections is most often asymptomatic, but heavy infections with H. diminuta can cause weakness, headaches, anorexia, abdominal pain, diarrhea, and etc. Praziquantel as a single dose is currently the treatment against Hymenolepiasis. Expect a full recovery following treatment. So both niclosamide and praziquantel have been very effective and had minimal side effects. Niclosamide causes death to the tapeworm by interfering with oxidative phosphorylation using 40 mg per kilogram for one dose only in children, while praziquantel causes paralysis and death using 25 mg per kilogram for one dose only. So how to prevent and control this type of disease? So accordingly, health is always be wealth, diba? So we as a human, we must take care of ourselves. We must do practice a proper hygiene, just like taking a bath every day or proper hand washing, and of course a general sanitation and rodent and insect control in order to prevent the spread of Hymenolepiasis.